Yeah, let me share my screen. Okay, hello everybody and welcome to today's stroke rehabilitation service review overview. My name is Beth Fetcher, I'm an engagement manager. If I just go around the screen and let everyone introduce themselves. Scott?
Hello, I'm Scott Webster. I'm the head of program management, design, quality and assurance for Derby and Derbyshire Integrated Care Board.
Mark?
Hello, my name is Mark Stewart and I'm with the Integrated Care Board as an engagement officer.
And Jacinta?
Hi, I'm Jacinta Bowen-Byrne, interpreting today's presentation.
Okay, thank you very much. So today we're just going to give you a bit of an overview, a talk through the case for change, and that's a document about understanding the background of this review and understanding what the service offer is across Derby and Derbyshire. And then we're going to talk about the engagement opportunities. So if I just ask Mark to go to the next slide, please. So just today, I'll say just breaking it down. So we're going to do, Scott's going to talk through that summary. So why is this review taking place? I shall talk about the engagement plan, giving that overview of how to get involved. And then we will talk about the next steps following the engagement. So if I hand over to Scott to talk through why it is happening and what are we doing.
Okay, so I'll just provide a summary of this slide. So why are we undertaking a stroke rehabilitation service review? So there is three main drivers why we are doing this piece of work. So first and foremost, currently in Derbyshire, services are not compliant with national guidance. So there was some new guidance launched in 2022 which was called the National Integrated Community Stroke Service Model. So that's one of the first drivers. Another driver on there is community stroke services are currently very busy and many people need their help. So just a bit of background behind that. Over the past 3 years, there has been a 6% increase in stroke admissions across Derbyshire, which is leading to put more pressure and demand on current services within Derbyshire. Another key driver is that currently we have a patchwork and a number of fragmented services across Derbyshire. So services are different depending on where you live, and this is currently not fair. So you may have a slightly different service in the north of the county in comparison to the south, and we want to get to a position whereby everybody gets offered the same service no matter where they reside. And fundamentally, the most important thing is we want to improve care for all stroke patients. So all patients that have a stroke are supported to recover both physically and mentally from their stroke itself. So if we move on to the next slide, please. So this slide here just gives an overview on the recovery to support patients. So what's included in stroke rehabilitation services? So first and foremost, physiotherapy. So from a physical perspective, so that's to help with movement. Occupational therapy to help with daily tasks. Speech and language therapy to support with talking. More with the mental side of recovery, there is psychological support to help with feelings. And then there's some elements there with lifestyle, so diet and nutrition support. And finally, nursing support with help with any medical needs that an individual may need. Next slide, please. So the benefits of stroke rehabilitation. So rehabilitation can help people recover after a stroke, both physically and mentally. Therapy can help people live better lives after a stroke. Quick and organised care after a stroke can help stop more strokes. And recovery can take many years, so long-term care is also important as part of any future services. So these next two slides just give a bit of an overview of how the current stroke rehabilitation pathway looks in Derbyshire currently. So it's quite complicated, and there are 4 possible patient pathway routes for patients following a stroke. So the first possible pathway is early supported stroke discharge. This can help with those people with mild to moderate disabilities. It lasts about 6 weeks, and it's aimed to provide care at home, improve independence, and reduce the length of time of people in hospital. It is not available everywhere. I think it's also worth including there is that in the north and the south, there is 2 different providers that provide that service. So in the north of the county, it's Chesterfield Royal Hospital who provide early supported stroke discharge. And in the south, it's DCHS, Derbyshire Community Health Services. I sometimes get that one wrong, so I have to get that one right. So that is the first pathway. The second route is a referral directly to community rehabilitation services. So this is for people with more severe strokes or for those people who need longer support. I think it's also worth adding there that following early supported discharge, if a patient still requires more rehabilitation support, they can also be referred onto community rehabilitation services too. Next slide, please. So the third pathway we've got there is hospital outpatient services. So this is for appointments in a hospital. So that may be following a discharge from hospital. There is opportunities to get further rehabilitation needs there via outpatient services, and they tend to be in hospital settings. And then the final one is no further rehabilitation is needed. So this is for people who's had a stroke, but they do not need any further support in terms of their recovery. So this is for people who don't need more help after their stroke. Other key areas to pick up there is people who live in Glossop or Glossop Dale may go to hospitals outside of Derbyshire. So in the very north of the county, because it's very important to get support as soon after a stroke, is that rather than patients in the High Peak and Glossop travelling down to, say, Chesterfield, they would be conveyed to the nearest hospital, which is over the border into Greater Manchester to Stepping Hill, more than likely. So we do have Derbyshire patients who go outside of the county for stroke services. So they access different rehabilitation services, and we currently want to make sure that this is fair too. So for all Derbyshire residents, we want to ensure that everybody gets a fair service. Just a final note there about Glossop is we do not commission services in Glossop. However, we are keen to listen about patients and their carers' experiences of stroke rehabilitation to inform providers of what works well and not so well.
Okay, thanks, Scott. Jacinta, we're just noticing that there's a bit of buffering on your video. I'm not sure if there's anything that could be done about it. Just wanted to flag it with you.
You can flag it. I have no idea what to do about it or with it. So unfortunately, I'm working in the office with the Wi-Fi that we have. I don't know what else to say. Sorry.
Okay. Yeah, we'll just see how it goes then. Just bear with us.
Sorry.
So another provider which supports services in Derbyshire is the Stroke Association. So there are 3 ways that they provide support to stroke patients. So we have a service in the north, which is the North Derbyshire Stroke Recovery Service. So this is for personalised stroke support in North Derbyshire. There is also a communication support service. This is more in the south of the county. So this helps people to improve the communication. And finally, in the very far north, there is the Glossopdale Stroke Recovery Service. This provides personal support for residents of Glossopdale only. I think an overview of those three services currently is that those services are not standardised and they differ dependent on where those services are provided across the county. So, what do we already know? So people have told us that the following are important to them. So personalised care. So it meets the needs of the individual. Communication. Fair access to services. I think I've already provided an overview there that we have a bit of a patchwork of services across the county. Support for patients and their families and carers. So obviously it's that family network support, so it won't just impact on patients, it will also impact on the wider family unit. The need for a community stroke service, addressing health inequalities, engaging with general practitioners within general practice and primary care, more mental health support. So we spoke about the need to recover both physically and mentally. So I think it's really important that we embed mental health support as part of any future pathways. Quicker community therapy after hospital discharge. Obviously, I spoke at the very start about the key drivers behind the service change, and there has been an increase in demand on services, which can impact on waiting times. So that's something which we need to consider. And lifestyle programs for health improvements needs to be embedded into the whole pathway, including those patients that may not need any further rehabilitation needs after a stroke. So we know there are gaps in ongoing support and rehabilitation services for stroke survivors. I'm going to hand over to Beth now. Thank you.
Okay, thank you, Scott. I just want to talk a little bit about the engagement that we're doing. So firstly, what is engagement? So engagement is about listening to the patients and the public and carers across Derby and Derbyshire to look at these key areas of the engagement, which is about what works well with the current service and what people feel could be improved. And then to look at the future services and asking questions around what is important for that future service as well. So we've developed different methods of trying to make sure that people have opportunities to understand what is happening in regards to the review, and then different methods to be able to get people to get involved in it as well. So we've developed a tile on our engagement platform, which is an online platform where people can get information about the review, can sign up to the events, and can also do the survey on there as well. We've also developed an information and involvement flyer that people can either print off or people can request from us to be sent to them. And this is also on the engagement platform, so you can have a look at that and download that. We're doing engagement workshops. So this is where we can have more in-depth conversations around certain aspects. And we're doing a mixture of online and face-to-face events. We also have a survey, and this is a more detailed questions around covering those aims that I've just spoke about around the current services, that future services, but also asking questions around access and travel. So you can get that in a few different ways. You can get it from the engagement platform with a link. And there's lots of social media posts around where people can put it on their social medias and have links to that as well. Or you can request to have a survey sent out to you as well with a free post address as well. We've also got phone support in place for everybody that would prefer that. So that is if you want to request a postal survey, if you want to get support in booking into an event or support in completing a survey or for any other accessibility needs, then you can just call our number that I'll go on to in a minute, and then we can support you through that process. the engagement events. So these are just it's a little bit of a poster snapshot here about what we're doing. So on each of these events, we're doing the first two are online, which is on the 22nd and the 24th, and then the next 5 sessions is we're doing one in Derby, Belper, Glossop, Chesterfield and Buxton. So again, if anyone is interested, then we do ask that people sign up to those events, so we understand anybody's accessibility needs and communication preferences, and you can just either use the QR codes or the links on the engagement platform, or again phone us, and the number is at the bottom here, and it's 01332 981 601. Or you can drop us an email as well on that email of ddicb.inquiries@nhs.net. The engagement platform that I've spoke about a couple of times there. So that is it gives details about it has the full case for change on there, which tells a really in-depth look at all those different elements that Scott spoke about but in more detail. There is a aphasia friendly case for change, and there is a summary case for change. So it has different access needs depending on what you prefer. There is also the engagement plan on there, and then there's the links where you can sign up to all the different events, or you can take the survey as well. And you can get on there by going on derbyshireinvolvement.co.uk, and then you click on the stroke rehabilitation service review. I think that's all we have to do around the engagement. And then what happens after that? So the engagement is running until the 24th of November. Then all the feedback from all the different methods that we've spoke about there will be put into a report. That report will then be used to inform the development of the future options going forward, which you'll be kept up to date with the development of the whole service review. Again, on that engagement platform, we'll update all the different stages where we are, and then how you can keep informed as well. And that is all from me today. Any ending comments? No? Okay. I'll say thank you to everybody for coming today. And if you want any further information, then please contact us on the details on the engagement platform. Thank you very much.
Thank you.